Welcome to Catholic Ethics and the Challenge of COVID-19, a live webcast series presented by the Catholic Health Association and Georgetown University, in cooperation with the Pellegrino Center for Clinical Bioethics. Thank you for joining us. My name is Jacob, and I will be the operator for today's presentation. Before we get started, I would like to acquaint you with a few features of this web event technology. At any time, you may adjust your audio using your computer volume settings. There will be a question and answer portion of the webinar. To submit a question, just click on the Q&A icon located at the bottom toolbar of the Zoom platform and enter your question. Please note that today's presentation is being recorded and both the recording and slides will be emailed to you. We are joined today by Brian Kane, Senior Director, Ethics for the Catholic Health Association. At this time, I would like to turn the presentation over to Brian for opening remarks. The floor is yours, Brian.
Thank you, Jacob, and good day to everybody. Thank you for joining us for part 6 of this special series presented by the Catholic Health Association of the United States and Georgetown University, entitled Catholic Ethics and the Challenge of COVID-19. Before I introduce today's presenters, let us take a moment to reflect on this poem by Kitty O'Meara. And people stayed home and read books and listened and rested and exercised and made art and played and learned new ways of being and stopped and listened deeper. Someone meditated, someone prayed, someone danced, someone met their shadow, and people began to think differently, and people healed. And in the absence of people who lived in ignorant ways, dangerous, meaningless, and heartless, even the earth began to heal. And when the danger ended and people found each other, grieved for the dead people, and they made new choices and dreamed of new visions and created new ways of life and healed the earth completely, just as they were healed themselves. We are very honored to be joined today by Sarah Vitone and David Miller from Georgetown University. We'll discuss the role that medical and nursing students and other healthcare students play during a pandemic such as COVID-19. Dr. Sarah Vitone serves as a clinical bioethicist with the Pellegrino Center for Clinical Bioethics and is assistant professor at Georgetown University School of Nursing and Health Studies. She also works in clinical nursing administration at Suburban Hospital Johns Hopkins Medicine in Bethesda, Maryland. Dr. Vitone has more than 25 years of experience in clinical bioethics with 10 years in research ethics. Dr. Vitone received bachelor's and master's degrees in nursing from the University of Virginia and a master's in religious studies also from the University of Virginia. She completed her doctoral work in bioethics at Loyola University, Chicago. Dr. David Miller is the Associate Director for Academic Programs and Administrator for the Center for Clinical Bioethics at the Georgetown University Medical Center, where he directs the bioethics courses for first and second year medical students. He served as a research analyst, senior research analyst for both President Obama's Presidential Commission for the Study of Bioethical Issues and President Bush's President's Council on Bioethics. The philosophy courses he taught most recently at Georgetown are Philosophy of Medicine with Dr. Pellegrino and Bioethics and Public Policy. Current issues in bioethics that interest him most include conscience and refusal clauses, healthcare reform, professionalism, and bioethics education in medical schools. Today's event is 30 minutes long. If you have any questions during the discussion, please go ahead and enter them in the Q&A module, and we will answer them at the end of the presentation. And now I'll turn it over to Sarah and to David to begin the presentation.
Thank you so much, Brian. David and I are pleased to be here today, and we've worked together over the past, I think, almost 15 years, and we are happy to be here today to talk about the role of medical and nursing students during the pandemic. While this is an important topic, I just want to share that these are our thoughts and our work that we've put together, and we've put together this for your consideration from our work. One of the things that we want to think about today is putting together for you, thinking about the students, the educational institutions, and the healthcare organizations in which they train and practice. And we're going to be highlighting the tensions, the competing needs, dilemmas, and opportunities that are faced in these three ways. Professional students, just to mention, not only are we talking about nurses and physicians, we'll be thinking about professional students in a larger way, including counselors and dentists and physician's assistants and all of those students that fall into the healthcare professions.
Thanks, Sarah. I'd like to sort of we'll lay out our cards at the beginning just to let you know sort of what our conclusions are up front. I think these are three things that we thought were really important to takeaway points. First is the importance of practical reasoning. We need to use practical reasoning to determine the most judicious course of action for all of the stakeholders. Conditions, information, and our understanding of the disease itself are all constantly changing rapidly. While our ethical principles do not change, our ethical analysis depends on facts about potential treatments, risks, benefits, and conditions and threats. Policies need to keep pace as best they can, but it's a constant process of practical reasoning. Another really important element of dealing with the conditions that we're facing is emotional intelligence. Emotional intelligence consists in the capacity to be aware of, control, and express one's emotions, to handle interpersonal relationships respectfully, judiciously, and empathetically. It is an element both of resilience and of assertiveness. And it's important for all members of the teams to try to exercise emotional intelligence. And finally, we need to really recognize the importance of relationship. The physician-patient relationship or clinician-patient relationship is foundational to all healthcare practice. And it is the center of medicine and nursing and the healthcare professions. Relationship is also central to Catholicism. God himself is relational and is in relationship. And so that is something to bear in mind as we look at our issues as we go through this presentation. So quick outline of what we're going to do. First, we're going to look at the foundations of the philosophy and ethics of the healing professions, just to get a general grounding in what we're looking at. We're then going to look at the various stakeholders, both the schools, the organizations, and students, and then look at the systemic limitations, constraints, and competing goals and commitments that they have. We'll look at guidance from professional associations on how to deal with trainees, professionals in training. And then we will look at student-identified concerns. And finally, we'll open it up for some discussion. So the foundation of medicine and nursing and the healthcare professions is the clinician-patient relationship. And that is based, according to Dr. Pellegrino, on these three elements. First is the fact of illness, the vulnerability of patients, their dependence upon healthcare practitioners to assist them, to give them information, and to help them. They are anxious and vulnerable, and that's particularly the case at times like this during the pandemic, when they're also isolated and have difficulty communicating. The second element is the active profession. When a professional, a healthcare professional says, "How can I help you?" they're implicitly promising that they have the competence to help you. And they're also saying that they have a willingness to efface their self-interest to some degree, and that they will put their knowledge to help you and to advance your best interests. Finally, there is the act of healing. That is the using of one's skills to heal the whole person. In this situation, the current situation, we're looking at the context and stakeholders. We can see how they overlap. There are overlapping interests. And we're going to focus really on the yellow area here, which is where there are some conflicting interests. That is, everyone has a primary goal of serving their patients, but they will have competing obligations that shape the way that they interpret how to best pursue that primary goal. They may prioritize competing goals differently, and that may affect their relationships and the way that they treat one another. We need to start off at the very beginning by recognizing that clinical rotations are currently on hold. So students are not being permitted into hospitals. Trainees are not being allowed to interact with patients. They're kept out of that. They're taking courses online and doing what they can and doing, but we'll talk about all of the things that they're doing. But those rotations are on hold, and that's what is causing a bit of uncertainty and anxiety. I want to talk about the obligations of schools of healthcare professionals. First of all, they have an obligation to teach, train, and certify, which, as I said, are on hold for those clinical rotations. They teach all of the skills that are necessary for competent practitioners, and they maintain academic standards. They certify compliance. They also have fiduciary responsibilities to safeguard the health and well-being of their students, of their faculty and staff. They also have an obligation to recognize students' vulnerabilities. Just as patients are vulnerable to physicians, they expose themselves. They have to discuss their social histories. They have to expose their bodies for examination. Students are vulnerable. They have to expose their ignorance. They have to expose their weaknesses and be guided in developing. And there's a vulnerability there that schools must protect. They also have a duty to advance the professional formation of students. So it's not merely didactics and imparting of information. They really have to model and apprentice. They have to respect that healthcare education is an incremental developmental process that builds upon itself. And that's an element of healthcare education that is somewhat unusual. They also have to inculcate a lifelong self-directed learning habit in their students, and they have to really focus on self-care and resilience. Sarah, did you want to tell us a little bit more about self-care and resilience?
Right. So when you're forming these students into that role of the healthcare professional, it's important to think about what those professionals are going to experience in their career. And so students begin to experience that when they meet a patient who's vulnerable. And so some of the stresses that happen when you step into those professional roles, we want to make sure that they're ready for, that these students are ready for that when they go forward. So being a resilient person not only comes from the values and the capacity that you have within yourself, but we can actually teach to it. And so we do things along the lines of teaching reflective behavior. We teach about being resourceful, how to work with teams. So some of that teaching also might lend itself to reminding these health professionals to keep a good lifestyle, to eat and sleep and rest and do the things that you can to take care of yourself, because unless you take care of yourself, you're not going to be helpful taking care of others. And so some of this resilience also is grounded in ethics. And so teaching ethical capacity, helping students feel grounded in the values, the principles that we go forward in making decisions. And in addition to that education, it's really important to sort of tie that back to the resilience. So resilience is really a multi-pronged approach, but it's important that schools spend time in this so that we are graduating and launching into the career of health those type of professionals that can continue on and feel empowered to work forward.
Thanks. I want to also mention specific commitments, that is of Catholic institutions. So Catholic institutions have a responsibility to care for students' well-being and their spiritual formation and spiritual well-being. And I'm sure that people on the call can recognize those commitments. I want to talk about the obligations of healthcare obligations of healthcare organizations to students. They have an obligation to contribute to the training of future healthcare professionals as well, just as schools do. But they also have an obligation to safeguard the health and well-being of their clinical and support staff and trainees, as well as their patients in the community at large. And finally, Catholic hospitals or healthcare organizations will also have particular duties based on their particular missions and charisms. So there will be other obligations that they would have towards students. I'd like to discuss the characteristics of students in the healthcare professions because, again, they're slightly different than, they're not undergraduates, and they have a different character. Most of them see their profession as a call to help and service, as a vocation rather than merely an occupation or career. They are adults. They are learning not only the material presented, but also to become self-directed lifelong learners. And they are forming their professional and personal identities. They are actively, reflectively engaged in that activity. This is an internal developmental process, and they seek meaningful engagement and participation in their own growth. They want to be participants in their own education and don't want to be merely directed. They want to participate. We should note that they are students of healthcare systems as well as of patient care. So they're familiar with the systems and the problems in systems and in the healthcare system in general in the United States. And they are thinking about those concerns as well. And finally, it's really important to recognize that students, especially nowadays, I've been teaching and working with students for the last 30 years. They understand themselves really to be parts of healthcare teams, and they rely on one another, and they expect to be treated as collaborative members of teams. So I want to talk briefly about the constraints, and then we'll talk about the students and what they're facing now. The healthcare organizations have constraints with respect to students, really with limited resources. There are limited resources are problematic across the organizations. And healthcare organizations must decide how to best prioritize the distribution of those scarce resources. They also have, in addition to onboarding people, in addition to limited personnel, organizations are concerned about reactivated retired healthcare practitioners who are helping out, and reassigned practitioners, specialists from other disciplines who are brought in to help out during this emergency situation. And that's something that they have to deal with, and it's a pressure or a challenge for them. They have, because of the emergency nature of this, there are limited supervisory personnel for students who would be in the wards. And although healthcare organizations are committed to educating future healthcare professionals during a pandemic, they're also committed to reducing redundancy, optimizing systems, prioritizing safety, particularly during a healthcare crisis. The challenges for professional schools during this time are, again, reassigned personnel. Many of their adjunct instructors may not be available to teach. Given that healthcare education builds upon experience, reorganizing the order of courses and assignments may prove difficult. It's difficult to change the cars of a train while it's in motion, and there's a steady stream of students who need training in the various services. And as mentioned earlier, they also have a duty to minimize risk to students, and this includes health and liability insurance, ensuring that they have proper training. They have to consider the fact that students might become ill and would need to take time off, or they might become exposed and might have to be quarantined or self-isolate for a period of time, and it would be difficult to reintegrate them back into the curriculum.
I would just add there, David, that this is a really fluid moment. And we are literally in the crux now across the country of schools making decisions and organizations making decisions. And so everyone is working together very closely to help generate our next generation of healthcare providers. And so I think one of the things that we're added to this, David, if you'll go to the next slide, is the guidance that we're getting from the professional organizations. And that has been very helpful. And they've been telling us that we need to continue academic programs. And so what we've all been doing is having a creative moment, right? So we're doing lessons on Zoom. We're using very creative case studies, unfolding situations with the students. We're bringing in speakers. We're having simulations. We're doing all of the things that we can to continue on with the learning. And thinking about as courses start to reopen about the primary safety of the student. Students are not employees of organizations. They belong to the academic institutions. And so we want to make sure, one, that they're safe and that they are well educated. The organizations, the professional organizations, always keep us attentive to the fact that should this or any likewise pandemic and unprecedented times get to the point where we need students to backfill, we want to make sure that we have a contingency plan and that we can do that in a safe way. That also is additive to the quality of the care that the patients are receiving. We want to make sure that students understand that volunteering is not part of their educational curricular courses, that volunteering certainly would be, I imagine, on their own like personal level. We do have that, and we're going to speak to that in just a minute, but it's not part of what academic institutions are providing. And we have to be, again, careful about their illness and mitigation. And also the organizations are telling us to also be cautious with the students' emotional well-being, because they are also in limbo. And we're going to mention some of the things the students can be thinking about. So some of the entry-level students that are coming in and strictly in didactic, might not be in the clinical setting yet, are also feeling the stress and uncertainty. You know, where are my classes going to be, and am I going to be back in the room with my friends, right? It's that the way that people learn, right? They learn by sitting with each other, next to each other, and doing flashcards, and you know, all of the ways that people learn and they talk about things. You can do that, right, on Zoom or on the phone, but we think that the students are missing that facilitation of being together. And that's, you know, an important point around all of this, the pandemic. The social connectivity that we need just in our own lives, right, are being felt by the students. They're feeling unsure because how am I going to become the nurse? Am I going to become the physician? How am I going to be able to get through that? And we are at the crux of making good decisions with them about how that's going to continue to move forward. There's the idea of housing. There's uncertainty around, you know, should I move home? Where do I live? They're, you know, concerned about all the various pieces. Where is my medical insurance going to be? And then David, next slide. If we'll talk about the upper level students, right, have a little bit of an additive feel to, they're ready to be the professionals, but yet also feel constrained. So I'm ready, but I'm not. And so we want to help the students sort of to move past that. We're thinking about how employment opportunities come up. These are students that are graduating in the next, say, 6 months or so. And so how are those students going to be embraced by organizations? And the students are watching the news and seeing the social media. They see the stress that the physicians and the nurses and the staff are in, and the end of life decisions that are having to be made. And what is the treatment plan? What is the next hope, right, in the research? And so that's causing them to have some distress. They see that as their next step. So we want to make sure that we're addressing that with them. We want them to be ready. We want them to feel the confidence of the next step. And so what are the students doing? And this is kind of interesting because we're getting a lot of feedback about this. And students are volunteering. So on their own, they're going out and taking that step in their own personal lives, right? They're part of the contact tracing. They're part of support staff. They are putting together the PPE packets so that the professional staff can be safe. They're doing follow-up phone calls. They're being the scribes. They're doing the things that they can do. And they are also employed in certain positions. So we have some students who have jobs on their own. They are phlebotomists, or they are working as techs. And so they're out there doing their part, just like the rest of us want to be helpful to that. We are knowing that the licensing folks, so like the National Council for State Boards of Nursing, is putting out guidance on how they're, you know, going to be doing the testing for the nurses to be able to get their licenses this summer. And some schools are allowing some flexibility in their hours and accelerated graduation. So we know that there are things going on that are helping the students. So Brian, Do we have a little bit of time? I'm losing track on time. Do we have some time for
Yeah,
discussion?
a couple minutes.
Great.
So, in your experience looking around the country and the colleagues that you know, how do you think that most of the healthcare schools did with this transition about communication to students?
So I think there was a lot of communication. And I think that what was interesting about, if you go back to like February, March, there was a lot of changing of the science and changing of how we were addressing things as we move forward. So I would say there was probably a good 2 to 3 weeks where there was a lot of communication and we were getting ahead of it, right? Once we got into late March, I think probably we were in a steady state of bringing people along. Sometimes I will say that, schools and organizations had to make decisions, and it was primarily for the moving the pandemic mitigation forward and dealing with the patients that we were dealing with. And so we had to put students in a safe space. And I think that was the important part of those early decisions. Yeah.
Yeah, I would agree. I think that communication has been good. In the crisis, things had to shut down, and there wasn't really time to talk through and communicate and get feedback from students because their health and safety was, especially in the face of all of the unknowns, was the most important thing. And now I think that students need to be brought into the discussion and to consider how they can be reintegrated back in as we move forward, as we have better understanding.
And the few examples you gave, I did read some stories about the different medical schools, moving graduation up to have the students who are at the end of their training really get their feet on the ground and help in whatever way they can. I suppose with looking at this possibility of a second surge coming in the fall, and the challenge, at least with colleges and universities, not even knowing at this point if they're going to be able to bring students back on campus or they're going to have virtual learning. This is probably going to have some deep effects for the training of students in terms of their clinical rotations. Are there any anticipated solutions to how that would work itself out over the next year or so, and try to get students to remain on track, at least for their education?
I can start with that, David. I think that what we're doing now, because the situation is fluid, I think we're putting into place some of the pieces of where can we move didactic forward, where can we adjust courses and move things so that students are staying on track. We want to make sure that we accommodate clinical hour requirements and things of that nature and try to move those to a place where we think that the health system will be more grounded and more in a stable way to be able to take the students back into clinical settings. So we do have a lot of opportunity to move things around. So I think that this is the challenge, right, for faculty and deans to be really thinking about that. Yep.
Yes.
Yeah, there are lots of contingency plans. There are, decision trees, trying to figure out what will happen if A, then what will we do next? If B, what would we do next? So there are lots of those different plans, and that's true with the testing organizations as well, trying to ensure that testing continues and that people can move on and keep on track. So we're playing it by ear though.
Definitely is a challenge. Well, thank you both for joining us today. I appreciate your time. I think looking at this question of practical reasoning and really also how to be emotionally intelligent with some of these decisions and taking into consideration both organizational, educational, and student needs at the same time is a very hard balancing act. I think we really want to maintain that question of or the emphasis on building relationships. Certainly, I know that clinical rotations and the opportunities for those rely really upon relationships between both the healthcare organizations and the educational institutions, and that both are being challenged at these times. And it's important to maintain that communication with them just so that we can all continue to have a good work situation. So I appreciate your time with us. And with that said, I'm going to pass it over to Jacob.
Thank you. And on behalf of the Catholic Health Association and Georgetown University, I would like to thank you for participating in today's event. A recording will be sent in an email and will also be posted on CHA's website at chausa.org, where you can also find recordings of previous sessions in this series. Today's program is copyright 2020 by the Catholic Health Association with all rights reserved. This concludes today's program. Thank you and have a great day.